welcome to the Therapist Thrival Guide. My name is Miranda. I'm a licensed clinical social worker, and I'm here with Kaylee and Stephanie to talk all about working with really young kids, kids under 5. Kaylee, do you want to go ahead and introduce yourself?
Sure. My name is Kaylee Boyson-Clonata. I'm an LMFT in Portland, Oregon, and I own and founded Family Roots Therapy here in Portland. And we really focus on the needs of really young kids and new families. So new parents, we do see the entire family in a wide age range, but really where my heart is at and where kind of our focus has been is the really little kids. So that's a little about
Awesome.
me.
I'm so glad to have you here. Stephanie, do you want to introduce yourself?
Yeah, my name's Stephanie McDonald. She, her pronouns. I'm LPC, which licensed professional counselor in Oregon. I also work at Family Roots Therapy. I'm the clinical director here, and just kind of echoing what Kaylee says about our practice, that we work with really young kids, but something that's unique, I think, about what we do is seeing the whole family. So we also work with adults, couples, family systems, parent-child dyads, and everything in between.
Awesome. Well, let's jump into our topic. Um, Curious, just as we're talking about working with super young kids, in order to work with kids under 6, do you have to be DC 0 to 5 trained, or can you jump in without having that training designation?
Yeah,
Great
that's a great
question.
question.
Yeah, great.
Go ahead, Stephanie.
Yeah, you don't actually. Surprisingly, you don't need any specific training. There's really nothing that says you have to have any kind of specific training. And it really depends, I think, where you want to start and where you work. I definitely recommend having training before starting working with kids and families, but there are also a lot of practices that will train you as you're working there. So it also depends on kind of what your orientation is and what the approach is, and if where you're working wants you to have a specific approach as well. Certainly very helpful to have a lot of early childhood background.
Sure, sure. I'm curious too, as we're talking about these different trainings or working with younger kids, how might the diagnostic process be different when you are working with super young kids versus working with a teenager or working with kids that are maybe more verbal or just older?
Yeah, that's a great question too. I would say it differs a little bit in that we're relying pretty heavily on the parent report. So we are relying quite a bit because a 3-year-old isn't going to sit down and tell us well, I'm feeling anxious. We are relying quite a bit on the parent's report, maybe a teacher's report, depending on the circumstances. And then what we're able to observe in an office and what we're seeing, and we're kind of piecing it together based on that. And I would say for myself, in our clinic, and probably most people I know who work with really young kids, we try to be fairly conservative about diagnosis and try to give kind of the least clinically or medical type of diagnosis possible, just because there's so much developmentally that's happening at that age that it can be kind of hard to tease apart. Well, this could be one thing, but we're going to maybe wait a year or two and see if they kind of grow out of some of this behavior, because it is developmentally appropriate for a 3-year-old to not be able to sit still, for example. So some of those things that might maybe point to particular diagnoses, we might wait and see let's see if this is something that developmentally kind of resolves, or if it truly does end up being a more of a diagnosis down the line.
I appreciate you saying that, because I feel like even just the idea of diagnosing a 2 or 3 or 4-year-old with depression or anxiety or, fill in the blank, feels kind of heavy, because they are just still figuring out, I don't know, there's just little tiny humans. And so it does feel tricky. I would imagine that you are diagnosing a lot of adjustment disorder, perhaps some trauma. What are some typical diagnoses or even presenting issues that you're seeing young kids for?
Yeah, I was just thinking that very same thing, actually, it's a lot of adjustment disorder. It's a lot of other specified trauma, stressor related disorder, sometimes PTSD, although much more rare with kids that young, but certainly can happen. It's much more at that age about what's happening to the kid and around the kid, what's the external circumstances that are eliciting certain behaviors and reactions, rather than some internal like depression, anxiety. Obviously, we wouldn't diagnose a personality disorder or something like that in a little kid, but those kind of things that for even teen or adult are more like, okay, what's going on internally? We're looking more at like what's happening in the family system, what has happened to this child that is causing whatever is happening to show up. And those tend to be more in line, those diagnoses.
That makes a lot of sense. I mean, they're adjusting to everything around them, adjusting to parent divorce, adjusting to moves or, fill in the blank. So I appreciate you saying that. I think that makes a lot of sense. What are some other kind of presenting issues that you see really young kids for typically?
I would say a lot of it, very often there is some kind of family conflict happening. Not all the time, but I would say it's pretty frequent that we see kids where maybe there's been divorce, maybe domestic violence is a really common one that I've seen. Sometimes, grief and loss or something going on with someone else in the family that then they're maybe adapting to. And sometimes just behavioral issues too that we're kind of trying to get at the root of. So sometimes that's okay, they're hitting, biting, showing a lot of aggression, maybe at childcare or with parent, like more so than what is typical for that age. Those are some of the things that we'll sometimes see. I don't know if Stephanie would add more that I've missed.
Yeah, I mean, I think you hit on a lot of it, and thinking too, a lot of times it's what's going on with the parent. The parents come in saying like, my kid is having these behaviors, they're having these issues. And then when you get to it, it's like a lot of times how the parent was parented or not parented, and or the parent's own anxiety. And so sometimes it's like actually your kid having a temper tantrum because they're 3 is really typical. But the parent's anxiety about that happening is so big, and then they react from an anxiety perspective, and it escalates the child even more, and then it becomes this whole system that just is escalated from the dynamic. And so it looks like these big behaviors, but actually starts with very developmentally appropriate behaviors that it's a lot about working with the parent and going like, actually, this is okay. And let's focus on like, what do you need to do in those moments to regulate yourself so you can show up the way your kid needs you to right now.
That makes so much sense. Talk to me a little bit about, you mentioned with really young kids, you're going to have parents in the diagnostic assessment. You're going to have them in the intake, talk through a lot of kind of the initial stuff. What does parent involvement look like for both of you? And it might vary, but what does parent involvement look like for you in kind of your typical session and even like outside of the session?
Yeah, I think it does really vary depending on what is happening within the family system and what the approach of the therapist is. So like Kaylee and I have different approaches and ways that we like different, what's the word I'm looking for? Theoretical orientations. But I think at the age, so like 2 and under, the parents got to be in the room. There's just nothing that you really need to do with a 2-year-old without the parent. I think once they get to like 3, 4, 5, then you can certainly do individual therapy with play therapy, typically with a kid. So it could look like the parent in the room, and it could look like dyadic work with parent and child. And Keely probably will talk more about like child parent psychotherapy, which is a modality for parent and child. Or it could look like individual play therapy with the kid. And then for me, I'm seeing the parent, at least once a month because I've seen the kid weekly, and I'm doing on the side parent sessions. So I might have a 4-year-old that I'm meeting with weekly and doing individual play therapy sessions. And then at least once a month, I'm meeting, whether that's one parent, 2 separate parents, whether they're together, and working with the parent system and really talking about those things like how are things looking at home? How are you responding to your child? What's happening in the child's environment and what's going on at school, and getting the whole picture that, as Kaylee mentioned before, you're not going to get from a little kid. They're not going to come in and tell you what's happening. They're just going to come in and play and show you their world in that way. But really working with the parent on how to create an environment and responses that are supportive to the kid.
Yeah, and one of the models I'm trained in that Stephanie mentioned is child parent psychotherapy, which is really specific to kids 0 to 6 who've experienced some kind form of domestic violence or trauma or separation from a primary caregiver. And so that particular model almost always has a parent and child together in the room. So you're really working on like that attachment relationship and building that security. And that's really the focus of therapy. And then some therapists might might do more just pure play therapy, where they are just allowing the kid to have their own space and to play and to communicate in that language of play. And I think both can be great, but involve really different levels of parent involvement sometimes. But we're almost always meeting with parents separately as well to talk about, what's going on with the kid or updates or all of that. So I would say no matter what the model is, there's some element of that happening typically.
That is like a perfect segue into different theoretical perspectives for working with young kids. You mentioned child parent psychotherapy. We mentioned play therapy. What are some other kind of modalities that you two pull from or would recommend for anyone who wants to work with really young kids?
Yeah, well, I think play therapy is an overarching theme. It's not actually just a modality in of itself because there's so many types of play therapy. But I'm not going to list all the types that could exist, but I'll say there's typically like two camps, which is more like directive and non-directive. Directive being like the therapist comes in and has an idea of what is going to happen, or what do I want to get out of the session? What am I trying to get this kid to explore, or am I trying to build some skill? Where non-directive is more like the child's in charge of just coming in and leading the sessions. So I tend to be more non-directive, and I use child-centered play therapy as my primary modality. I also use some synergetic play therapy, which is more about like neurobiology incorporated with play therapy. And so it's really, for me, more about like, I want the kid to come in and I want them to show me who they are, and I want to meet them in that space. I don't come in with an agenda. Whatever the parents say is going on, I work with the parents on that stuff, but I don't specifically go, oh, this kid is really anxious, so I'm going to like, quote unquote, work on their anxiety. I'm just like, you come in and show me who you are and show me what it's like to be you in the world. And I want to meet you there and respond to you from that place, and believe that the work will happen just with the kid being themselves and how they show up.
What are some different tools and things that you have in your room for play therapy? Like, what are some, do you ever have like a sand tray? Do you have books? Do you have a dollhouse? Like, what do you have in your office for kids?
Yeah, I think a lot of the standard ones are a dollhouse, dolls, things that kind of encourage that nurturing kind of storytelling or relationship piece. Most of our offices do have some form of sand tray. I like to incorporate some sensory toys so that kids can have like fidgets or like the kinetic sand or Play-Doh or something if they just need that kind of sensory input. Stephanie, I'll let you continue because you have a pretty cool play therapy office setup.
Yeah, I'm not in my office today, so you can't see it. But for anyone watching, but I have a kitchen and gadgets and tools, blocks and like things to build with, um, different like puppets and baby dolls and stuffed animals, and little animal creatures. Trying to always have things like you said, nurturing, and also things that are scary. And also some like balls that you can throw around, medical supplies, obviously safe medical supplies. So I like to have things that might kind of people out a little bit if they don't know how to utilize them, but like ropes, handcuffs, play knives, things like that. So if that is the kid's experience, is being witness to those things or afraid of those things or curious about those things, then this is a safe place where they get to explore those ideas. And, if maybe their parent was arrested and they saw it happen, like having something like that where they can play out like arresting me and putting handcuffs on me. That's how they can play through some of those experiences. Or maybe just about control and wanting to feel like, what is it like to be able to be in control? I'm 4 and I don't get to be in control of anything. And yeah. Oh, and food, a lot of like play food. That's a very popular item for sure.
What do they do with the play food, like in the play kitchen? And like, tell me about how that's typically used.
Oh, I wouldn't say anything is typically.
Sure.
Yeah, I'd say a lot of sure. Yeah, I'd say a lot of what you would imagine of like the stereotypical like cooking, making something. When I'm doing parent-child work, it's pretty common that the kid wants to make something for their parent, or they want to have their parent maybe cook and like feed them. So kind of that like nurturing play. But sometimes, I mean, kids are creative. So, I've had a banana turned into a weapon. I mean, it kind of depends on what the kid is going through and what they maybe want to see in whatever's out there. But I would say that the nurturing theme is pretty big with food. So they might want to like cook a whole big meal. And then again, the control piece will sometimes come up of like, maybe they want to cook it all, maybe they want to have it all, but they won't let anyone else share it. Right. And they get to eat all the food and they're playing out some story related to that. So it can vary quite a bit, but I think it often lines up with whatever kind of theme the kid is exploring.
Yeah, food fight for sure happens. Sometimes the food is poisonous. So it can be around being like tricky and being like, oh, I made you this thing, you have to eat it. And then you eat it and they're like, haha, you're dead now. You just things can go from nurturing to not so nurturing pretty quickly.
Yeah, yeah. Okay, so we talked about how, Stephanie, you were kind of talking about how with the play therapy that you do, it's a lot of non-directive and kind of allowing the kid to choose how their session goes. Kaylee, with child parent psychotherapy, and the modalities that you kind of work out of, are those more directive, like more modularized, like structured, or are they pretty non-directive as well?
I would say yes and no. They are, I think, more directive than child-centered play therapy in that there is a structure and there are different phases that you kind of go through, and there is the therapist is introducing things in the room. So the therapist is saying, I know that this happened in your family, and I know that this is something you experienced, and this is a place we can talk about that or play about that. So the therapist is not kind of just waiting for the kid to introduce that, but it is still pretty flexible in that the kid can play. They can play whatever they want to play. We work with what comes up in the room. So I would say it is significantly more directive than something like what Stephanie's describing, but it's not entirely manualized where it's like, oh, we have, this is what we're doing today and we don't deviate from that or anything like that.
I feel like that, I mean, you would have to be flexible going
Yeah.
into work with really young kids, and that kind of goes into one of the other questions and like thoughts I was having as you were talking too, was what if a kid just doesn't want to engage, and just like, how do you both kind of approach a kid who maybe is like, we've all had kids in our offices that are like running around or throwing things, and we've also had kids that probably just like sit on the couch and don't want to answer anything. How do you approach kids who don't want to be there, or are resistant to therapy?
Yeah, I love this question. I would first differentiate between kids who don't want to be there versus don't engage. I don't think those are always the same thing. I think sometimes it's just the kid's way of being in the world, whether it's their personality or like neurodivergence or social anxiety, where it's not that they don't want to, it's that they just can't yet or don't feel safe to yet. And so they may actually want to be there, but just feel too afraid to engage or not know what to do and feel overwhelmed. So that might end up with them just sitting on the couch because they're just like, I don't know you and I have no idea what to do here and what this space is. Versus a kid who's like, screw you, I want to get out of this. Which either way, I think is just using a lot of reflection and creating as much safety as possible. So helping them understand what's happening. And you don't even know me. And it feels weird to be in a new space, the new person and all these things here, and you're not sure what to do. I try to not talk too much to overwhelm a kid that seems to feel overwhelmed. So sometimes I'll just start playing, but I'll just talk kind of through lightly what I'm doing. And I'll say like, yeah, you're choosing to sit over there right now. I think I'm going to choose to sit over here and start building. And I might just take blocks and start kind of building something. And then every once in a while comment on what I'm doing. And a lot of times kids will start like looking over, interesting. And then I'm like, oh, you're curious about what I'm doing. And then kind of can ease them into something, whether that's joining me in what I'm doing, or maybe they're going to go do something else and still take their time. And then that's okay too. And just going at the speed of whatever that they're comfortable with.
Yeah, I would agree with that.
Yeah.
Yeah, I can add to that a little bit. I would say My approach is pretty similar. I think I kind of try to meet where the kid where they are at in terms of that maybe our starting point is that we color in silence for most of an hour, and that's okay. I will say I've had a lot of kids where the beginning of therapy looks a lot like what people would say just playing, where maybe we're doing superhero play or like things that really don't seem to tie to what the kid is supposed to be working on. But it ends up really sitting it in with their narrative, and it ties in down the line. We can't always see as the therapist where that's going yet, but I would say we kind of trust the process that, okay, this is important and meaningful for the kid in some way, and there's a reason they're bringing it up. And I've been really surprised sometimes when maybe 6 months into treatment, I'm like, oh, that's where this all connects, right? Or, oh, this happened and that's, why this kid's play is so stuck here. Or so sometimes we are missing some of those pieces that we don't know. And I think just making an environment comfortable. What I tell parents is if I don't accomplish anything else in therapy, I just want them to have a positive experience so that they'll go back to therapy later at some point in their life and not have it feel like, oh, therapy was terrible. I don't ever want to see a therapist again. That therapist made me do things I hate, right? Like I really don't want that to be the experience that a kid is having.
Oh, that makes
And
a
I
lot
think
of
that
sense.
goes to the like kids who don't want to be there, which is typically going to be older kids, less so younger kids, when that does show up. But if you've done kind of everything you can do to make it feel safe and accommodating, and they just every week like I don't want to be here, if they're very obviously like I do not want to be here and I don't care about this, and my parents are making me be here, and it's just no matter what you do and how, gentle you try to be about it, that just doesn't change. Then at some point I'm having a conversation with the parents being like, look, this may just not be the right time, or I can work with the parents and help them and support them in what's going on with their kid. But just to Keely's point of, I don't want some kid who's coming every week being like, therapy is the worst and it's so boring and terrible. And then 10 years from now, they just have this horrible thought of what therapy is. And it's this thing you're forced to do. Also, how are the parents framing therapy is a question I want to know, because is it you've been bad and your behavior is bad and now you're going to therapy to get fixed? Is that the messaging that they're getting, or they're like the bad one in the family? And then they're just feeling bad about themselves and they're like, I don't want to be here and be, the problem. Um, versus this is a place that's supportive to you and can, this is someone who can help support you and be here for you besides your parents, and see it as a positive environment.
Yeah. I think one thing that I struggle with a little bit when it comes to working with really, really little kids is kind of having a treatment plan, having goals, but then also kind of being flexible with that. I mean, I work at a practice with insurance, and so there's a lot of different, like I have to be showing that we're making progress, or I have to be, you know, all of those sorts of things. So just curious, like what do goals look like at this age? And especially when you're doing like non-directive modalities, and then kind of what progress looks like as you're working with really little kids.
Yeah, that is really hard. And that's something we talk to our staff quite a bit about, is how to kind of translate some of these things into the insurance language and what insurance needs us to see. Because I do think there is value in having measurable goals, and all of those pieces that insurance needs us to have. And also sometimes it doesn't directly translate really well into how we talk about kids clinically and how we think about them. And so what I'm trying to look for is really talking to the parents in the beginning about, what specifically are they seeing and what would they want to see shift or change, and to try to really have that be focused on, for example, like their relationship. I often have a goal around the parent better understanding the child's behavior. And then sometimes I will have some of those behavioral goals, like maybe it's, okay, the kid is going from having meltdowns at daycare 5 days a week to maybe only 1 day a week, right? Some of those do translate, I think, into being a little bit more measurable. But a lot of times too, I'm just also making goals around the kid being able to express their emotions or their experience through play or through other kind of expressive modalities. And that way I'm kind of taking that insurance language, but also putting it in kid-friendly language, if that makes sense.
Oh, yeah, that makes so much sense. And what about for parents who feel like progress isn't happening fast enough, or maybe they're like, "Why are you just playing dollhouse in sessions?" Or, like, how do you explain some of the work that you're doing with parents and kind of what progress might look like for them?
Yeah, it's a great question because that happens all the time. And I always start with how I explain play therapy with parents, and do you have any questions? And often, oh no, that sounds great. And then a few sessions, and they're like, wait, so you're just playing? Like, okay, let's go over this again. And it takes several times because it's just not what people think of when they think of therapy. They think of sitting down and talking about things, and you're going to teach my kid how to X, Y, Z, whatever the thing is they want. And so, really explaining, I'm not a skills trainer. I'm not a teacher. That's not what I'm doing. It's therapy the same as with adults. It's just play instead of talk. And that play is the primary language for kids, even highly verbal kids, because they'll say, oh, my kid can talk about this stuff. Like, yeah, they can use the language to say things, but can they actually identify what is happening for me right now? What are the emotions that I'm feeling right now? What am I seeing happen for my parent right now? And put those pieces together. No, they really can't do that, even if they have a really big vocabulary. And so really being able to see that the way that kids play is how they communicate, is how they experience things through their world, is how they work through things. And the themes that come up through play. So, I'll talk about like themes of like good and evil, maybe, or it might be the theme that's coming up. And they're really trying to figure out what it means to be a good person. What does it mean to be a bad person? So learning how to translate those themes to things that parents can understand. Um, but I think just really reiterating that like the play is how they're experiencing those things and working through those things. And I often will give examples of like kids that I've worked with and things, obviously very HIPAA compliant, not sharing anything too much, but examples that can kind of make it feel more tangible to parents of like, oh, that's how that can look. While then at the same time going, and sometimes I have no idea what's going on, Sometimes it's like very clear. This is what's happening in this kid's life. This is what they're playing through. Like, oh yes, we can all see that that's what's happening here. And sometimes I'm like, I have no idea. They just want to, cook me dinner in the play kitchen every time they're here. So it's something around nurturing. It's something around, I can see these themes coming up. What does that mean to them? I don't always know, but I know that that's what's important to them, which means that that's what their therapy should be about.
Do you ever assign like homework in between sessions for parents to do or kids to do at this age?
I would say not kids for sure, for me. Parents, absolutely. Yeah. Always working on like how can they respond in different ways. And just to add to the treatment planning stuff too, there's often something around like teaching parents like positive parenting skills or things like that, like being able to increase their emotional responses to their kids or learn how to have emotional responses to their kids. Instead of just saying, stop that, actually being able to go, oh, you're having a really hard time right now. And having those emotional connections with their kids. And so practicing those things, something we'll talk about a lot.
What
Yeah.
about Oh, sorry, go ahead,
Oh,
Kayla.
no, sorry. I would say just add to that, I'd say similar. I don't necessarily assign homework to a kid, but I may assign things for the whole family to do or to work on. So maybe that's like they're going to have a family meeting every week, or they're going outside of therapy, or they're going to everyone in the family is going to maybe use some kind of emotion chart or visual or something like that, where it's not solely put on the kid as like, oh, the kid is the problem and the one who needs this tool, but then like the parents are practicing that too.
That makes
And
sense.
I would add that there's a modality called child parent relationship therapy, which is actually teaching parents how to do play therapy. It's basically teaching them like child-centered play therapy, but teaching the parents how to do it. And so sometimes I'll incorporate that if that feels like that's what's helpful for that particular family, and teaching them like, this is how I'm responding. This is how you can learn how to respond this way. And then having them have like what we'll call special playtime with their kids. So it's just 30 minutes a week, on Saturday mornings. That's all you have is 30 minutes a week. Then doing that and learning how to do it from a non-directive place, especially for parents that really, really want to be in charge of everything, can you give your kid just this 30 minutes of it's just their space and their time and they get to do it their way and build the relationship?
Do you ever do telehealth with really young kids, or have you ever done telehealth with little kids?
During the COVID times, I did. I will say I really was not a huge fan. It worked fine for some kids, but it was very challenging because kids, in a room, you have a lot of control over your playroom and what's in there, and the space. And when a kid is in their home, you really don't. So it was not uncommon for a kid to like run off with the phone or computer, and then you're getting kind of a roller coaster ride. Close the laptop, be, I don't know, getting into something that they shouldn't or what, and then we're kind of sitting there like, I don't really have control over this or can't. And so
Or they're
we,
like alone in a room and start playing video games because parents not in the room.
yeah, so definitely challenge. I would say doable to some extent, but with some parent support and definitely more challenging. I don't know, Stephanie, you had a different experience maybe, but
Oh no, very same. I remember, yeah, when COVID hit, I was working, the whole caseload was like young kids. And I was like, oh, we can't do this. You can't do play therapy with, the 4-year-old and virtually. And then I figured out how to do it. Lots of support, but figured out how to do it. And I was like, oh my gosh, this was actually possible. And that's really cool. And I think really cool for people, especially who live in like rural areas or don't have access. And if that's all they have, then it's really cool that we've collectively figured out that this is possible. And also not my preferred way to do things.
Do you still do any play therapy or virtual therapy with super young kids?
I don't. I know some people do, and I think more power to you. That's awesome. It's not my preferred way to do it at all. And I find there's so much that happens that's obviously with play, and it's not about just what you're talking about. There's so much information that's happening in the space between the two of you and around you. It's so much harder to get that information.
Yeah.
So I also find my brain has to work so much harder when I don't have all of that information. And so doing a lot of those sessions leaves me like very drained and is not very conducive to my own well-being. And so learning that, yeah, I think that's probably better for me not to do it unless I have to. I have to do it, I can do it. And that's cool. But
No, I was
not
just
ideal,
curious.
I think, on my end or on the kids' end.
Yeah, yeah. Any tips for therapists who are having to do it virtually from like what your experience was?
there are some pretty cool things that came out of the pandemic, like virtual sand tray, different, online Uno, like some different games and stuff. If a kid is old enough to do some of those things, that might be more like 6 to 8 and up. And for kids younger than that, I would say setting up some parameters with parents is really important. Of like maybe they set up like a big blanket with some specific toys or something, and so that the expectation is like, okay, we're almost recreating a playroom of like, okay, we're gonna be here and this is kind of our play space, and the parents helping support that. I think that can make a big difference versus just like running all over the house and hiding under the bed and all those things.
Yeah, I think exactly that, having those parameters around like a blanket or a towel, and then having the kid choose what toys do you want to have in your play space, and then having the camera angled so it's seeing the whole thing. And then some kids, some of their work is boundaries, and whether they're in our space or in their own space, sometimes that is the work. And so maybe they are going to keep leaving the space. And then that's part of what we're doing with them. And it's like, oh, you're first staying on the blanket, or you're first staying into your play space. And then we may have to keep doing that over and over again. And maybe that's just what part of the work for them is. But yeah, and having the parents be available. So some parents would go like, okay, bye. And then like walk out of the room and we're like, oh, wait, if I yell, I want you to be able to hear me. And also have your phone on you. Like, think of it, you're in the waiting room. So I'm going to call you on your phone if you need anything. But sometimes the kid needs to be on the parent's phone because they have no other device. And so then you need to be close by. So if anything is happening, I can say like, okay, parent, come on in here.
No, that makes a lot of sense. I remember early pandemic days and, trying to come up with like scavenger hunts or, just like there were so many ways that we were creative around virtual, like seeing kids virtually. And I primarily see people virtually, but I don't see as many kids as I used to, and certainly not that young. And so I was just curious how therapists are doing that. But so if you're a therapist listening to this and you primarily see kids that are really, really young on telehealth, hit me up because I'm so curious how you do that. Okay, switching gears a little bit. What about if you have kids who are in like foster care or have, like their parents are separated or they just have parents who aren't necessarily as available? Or like how would you approach working with parents in some of those circumstances? Or maybe if there's abuse present or something like that. Um, how would you kind of tweak the work that you're doing with kids and parents?
Yeah, it's so situational. Like there's so many things that are coming to my mind right now, like situations I've dealt with that are so much variety. Um, I was thinking of like I worked with a kid in foster care that was definitely it was a temporary situation. So like in that case where this, if it's a kid I would typically be like, I want to work with the foster parent and the kid and build this relationship. But in that case, I knew this wasn't a relationship that was going to last. So I didn't want to focus on that as a primary thing where this was a situation I probably would have had the parent in the room and chose not to. Because it was actually more important for this kid to just have a space for themselves and be working on their own self autonomy and self esteem rather than trying to build a connection that we knew was not going to last. Um, it's a foster situation that's more long term, then I do want to work on building that connection with the foster parent. Um, Also depends on is the bio parent involved or not involved. Sometimes they can be involved. Sometimes they don't want to be involved. Sometimes I don't have access to them. And so that a lot of times the court situation just dictates more so who we can have involved, but try to have anyone who wants to be involved to be involved. Like the more people that want to learn skills and support this kid, like the better. Um, yeah, Kaylee, what would you add to that?
Yeah, I wouldn't add too much to that. I think that really covers it other than so with child parent psychotherapy, there are some situations where we would do it's because it's with the parent and child together. There have been some cases where I might do simultaneous work where I'm doing some sessions with the child and a foster parent and then some sessions with child and a bio parent. And I'm doing those like maybe I'm alternating weeks, right? If I'm trying to support both relationships. I think it just really depends on the circumstances and who we're trying to develop that relationship with and what the kid needs. So it's very, very dependent on circumstances.
What about in a circumstance where like maybe parents are together and like one parent is definitely more primary, more, involved in treatment? How often would you try to pull the other parent in? Or I'm just thinking like of cases where I've had where I could see the kid for so long without ever seeing dad or another parent partner, and so what is kind of the expectation setting that you give the parents about having both of them present, or do you? I mean, is that something that you require?
For me, I'm a marriage and family therapist, so a lot of my background is in family systems, and I'm really looking to ideally work with the whole family if I can. But I also know sometimes one parent might have a work schedule that doesn't allow for that, or logistically, it's really challenging. So I do have cases where I might not really meet with the other parent. But I would say for me, it really depends on the family circumstance. I err on the side of trying to involve as many caregivers as possible, but um, I also, I also just know that that isn't always logistically feasible. And it also kind of depends for me on how much I'm seeing that impacting the kid. So if what I'm seeing is, for example, like the parent I'm meeting with, they're coming in and saying like, well, I want to do this, but the other parent is fighting me on it or is like really disrupting this process that we have going, then I might say, oh, well, we really need to involve them too then and have them come in. Whereas if that's not happening, I may not push that as much. So it kind of depends on what the family system dynamics are too.
That makes a lot of sense. Yeah. Yeah.
And you mentioned something about abuse too. I would say whether the parents are together or not, if one of the parents feels if it's an unsafe relationship, I'm not going to try and do like dyadic work as parent and child. I'm
Sure.
because I don't want to be a person that's trying to facilitate an unsafe relationship. So if that's what's happening, then I'm going to go, actually, how do we strengthen, even if it's an already strong bond between the safe parent and the child? I just want to focus on like, let's strengthen that even more, as well as the kid's own, sense of self, and not work with a parent who's abusive.
Sure, sure. Any other things that you feel like we have missed in this conversation, or other points that people might be curious about?
That's a great question. I'm thinking, I feel like we covered a lot. Nothing is coming to mind right now.
We
Yeah,
did cover a lot. Sorry, go ahead.
Oh,
You're
go
gonna
right ahead.
say- All right. Just thinking, if your parent out there is wanting to get your kid into the therapy, I think just familiarize yourself with different types of child therapy. A lot of parents just come in and just don't know what to expect, which is okay. And we can guide them through it. But there are different types of therapy, and there are different types of even play therapy. And if you have an idea of what you want, or if you don't, do a little research and go, actually, this feels like it really aligns with my values. Because otherwise you go and you get someone and it may not be what you want, it may not align with your values. And if that happens, that's okay. And you can always switch therapists. But I think it's really good for parents to get an idea of like, okay, how much parent support am I looking for here? How much involvement? How much do I want to be involved? Do I want to be in therapy together with my kid? Do I want them to have their own space alone? Just considering those factors before getting your kid to services,
So helpful.
if you have the bandwidth to do so.
Yeah.
If not,
Yeah.
that's okay too.
No, this has been such a good conversation. Thank you both so much for joining and sharing so much knowledge about working with really young kids and working with parents, because that's a gigantic part of working with little young kids. I mean, I remember when I first started as a therapist, I was working with kids, and I was always really intimidated by parents. And I think part of that was I wasn't a parent yet myself. And so obviously now I'm a parent and have been humbled like crazy about how we don't actually know what we're doing and we're all figuring it out. But I think that has been a really key part of this conversation, and just how we can be involving parents and supporting parents, educating and helping them be the best parents that they can be especially when kids are super young and they are, their primary caregiver, but also just like their primary influence, right? They're the one who we want to make sure that they are taking care of themselves and able to support their kid. And so that has been a really helpful part of this conversation. Thank you so much for joining.
Absolutely.
This has been great.
I want to say one more thing to the parents, that don't be afraid. If all this talk about working with parents has you be afraid that you're going to be judged, please don't be afraid. That is never, ever the goal. And I know a lot of parents come in with that fear. Like, someone's going to think I'm a bad parent. I'm going to be doing things wrong. I'm going to get told how wrong I am. And provided you have a good therapist, that should never be the case. The goal is always to support and go like, these are all the great things you're doing and what's not working for you, and how can we just make it work better for you? And that is always the goal, and never to shame anyone. So don't be afraid. Come to therapy.
Absolutely. Yeah. Oh, thank you so much. And thank you for everyone who's listening to this, subscribing, all the things. I appreciate you so much, and we'll see you next week.
All right,
Thank
thanks.
you.